let's talk about different types of carbs. I know that's your favorite topic. You get from your patient what are complex carb, what are simple carbs. As you can see, the complex carb on the left panel is the potatoes, rice, pasta, bread. And the simple carbs are sugar, honey, syrup, fruit, dairy. And you can get your higher amount of sugar from both sides, whether it's complex or simple. You got to pick complex if you have a choice. And then again, less white it is, better off we are. So if you can pick, as I said earlier, a sweet potato instead of the white potatoes. And if you're going to go with a pasta, go with chickpea pasta or vegetable pasta instead of refined flour pasta. And same thing with the rice. We get a lot of Asians in our practice, a lot of South Americans, and they have beans and rice as their staple.
Right.
And I tell them use brown rice, and then I started adding, in addition to brown rice, quinoa in my diet, and I think that's another fantastic grain which you can add to your salads, to your stews, to your beans. And if you pick more fruits here, again, the fruits, if you pick fruits, don't eat too much grapes or strawberries, but some is okay and better than refined sugar. If you're going to have sugar, maybe a little bit of honey or a little bit of brown sugar is better, because I tell one thing to all my patients, Venkat, is anything slow is go. And they ask me, what do you mean? I said, if you, for example, have oatmeal, if you have a quick oatmeal, it's pure sugar. And
Right.
if you understand this concept, I think most of the diabetics will make good choices, because the quick means there is no fiber.
Right. Right.
So that means it takes quicker to cook. And if you have fiber, it's like extended release medication. It does
Right.
not allow the sugar to escape quickly, and that allows your body to cope with the sugar coming out, compared to, let's say, soda pop or ice cream or juices. Your sugar goes up very quick, and there is no insulin, there is no wherewithal the body has, and then you get into more trouble. You want to add
Sure.
something more?
Yeah, sure. I think the concept you mentioned is called glycemic index, right? So, glycemic index is how fast your sugar increases after you consume any food, and it is compared to glucose, which is considered to be the highest or the benchmark. And compared to glucose, which is simple table sugar, how the food rises, how fast the sugar rises, is what's called as a glycemic index. And we know the higher the worse, right? The lower the better. And like you said, anything which has fiber, there's also a concept called net carbs, right? If you delete the amount of carbs and you remove the fiber from it, then you get net carbs. So if you have 45 grams of carbs, and we'll look at a label in a second, and you can remove that fiber, and you have less net carbs, because fiber really slows down the absorption of the sugar and lets the insulin catch up with the glucose, so that the sugars will come down slowly and steadily and not have these big spikes.
Let's talk about the other key nutrients. I know we got a long topic, with diabetes. Do you want to point out on fats and protein what you're trying to show here?
Yeah, I think just wanted to show the different components of your diet and how we need to differentiate go into the details. It is not just about the macros, but because a lot of people say, okay, how much protein, how much fat, and how much carbs, but it's also the type of carbs, right? And it's also the type of protein, and it's also the type of fat. So we all know not all fat is the same, right? We want to look at, like you said earlier, the polyunsaturated fatty acids, and you want to get your essential fats in your food from healthy fat, so to speak. Probably the most difficult thing to do. And like you mentioned, more olive oil and more vegetable oils than saturated fats. And in the protein, I think, like you mentioned about the resurgence, so to speak, about the plant-based diets in general. So I think a lot of push towards that. And if the patients want to, if it is a choice they would make, then I think going predominantly. That's why I like to call it a plant-based diet than a vegan diet, because you don't have to be a vegan strictly to get all the benefits that you need.
All right, so let's bring this slide up. That's a great slide you have. So If you're looking at healthy fats, then almonds in the nuts category. I won't say peanut is a healthy nut, but I'll put in the end.
Right.
Cashew too. Maybe more walnuts, almonds, pecans will be my first pick, and then
Sure.
cashews and peanuts. They're a little bit more
Probably the
fatty,
last. Yes. Yes.
but still better than eating anything else.
Right.
uh, Vegetable oils, you mentioned that, so skip that. So the butters, from the again, moderation, because they still have a lot of fat, so but better than putting let's say anything else on your toast. Avocado toast are in fashion. I think I'm a big fan of avocado. It's a good fat. It helps your stay full. And the fatty fish, the salmon, herring, trout, and seeds. So seeds are very important if you can add to your salads. And stay away from this class of fat: the red meat, the full fat dairy, the tropical oils, the lard, the fried food, especially the fast food kind, and the baked goods, processed snack food. So the one thing I tell my all right, so I think we covered a lot of areas, and most of the fruits are Mother Nature's candies. If you're gonna have a sweet tooth and you want a dessert end of the your meal, go towards blueberries, or maybe have any of these on this plate. Some of the higher sugar content, if you're gonna have in moderation. The grapes, the mangoes, the pineapples, the cherries, and especially avoid pickle or canned fruits, that has very high sugar, syrupy content of preservative. If you're going to eat, these are better to eat in a little bit more quantity: the blueberries, the strawberries, the kiwis, and the grapefruit. But if I am given a choice between a candy and a mango, I'll pick a mango. It comes with fiber, it comes with vitamin C. Candy only comes with sugar.
That's right. That's right. You're right about that. And I think this is probably the second most common question I get is fruit. Because when I mentioned that you should not be eating certain kinds of fruits, almost every single one of my diabetes patients is in shock. Oh, grapes are not good for you. Bananas are not good for you. Who doesn't have a banana, right? With their breakfast. Pineapples, some of them, mangoes, a few. Watermelon is a big one. People love watermelon, especially many of my diabetics are like almost in tears when I mentioned that they cannot have or as much watermelon or grapes and stuff like that. So it's fruits are for if you don't have diabetes, like you said, it's a great choice between candy and fruit is always much better. But if you have diabetes, unfortunately, the fructose in these fruits gets converted to glucose eventually, and it creates the same problem, if not more. So you have to make healthy choices, and you should have more vegetables than fruits and have different kinds and more with fiber. Berries are great choices, like you mentioned, pears. Apples are also moderately okay, I think, and oranges could be great because of the fiber and vitamin C that they have.